the Public Safety Committee meeting. First on the agenda is District Attorney.
Okay. So, do I go now?
Yes.
Yeah, that doesn't look like Kaylee Kading, but yeah.
Let me apologize for that. So this is just to fill an ADA position. We had an ADA leave, and we have the replacement. The former ADA was at a salary of $92,000, and this one is at $80,000.
Yeah, if I could just add, when I talked to the DA, he told me that besides cutting the $12,000, there was a position that he wasn't going to fill as well.
Yeah, so there's a paralegal position that the person left also that we're not going to fill.
Mr. President, could I ask a quick question about the request to waive the health insurance waiting period and to waive the 5% salary reduction, as to why you're requesting things be waived? That I'm new to the county, but my understanding would be that those were normal protocols that a new employee would wait, a requisite amount of time for insurance and whatnot.
They are normally the protocol, but when we're dealing with attorneys, we waive them because it's hard to get attorneys. So we waive the protocol, plus they're non-union. For all the union employees, we do the 15, 10, and 5, and then there's a 3-month rating period. But again, dealing with attorneys, we don't do that.
Got it. So it is protocol for this type of position that
Yes.
would happen. Thank you.
I'll
So we
make
need
a motion.
I'll second.
All in favor?
Aye.
Opposed? Carried. Thank you.
You're good, Jim.
Well, you said 3 minutes and you were right. Thank you.
Take care.
Thank you.
All right. Stay safe, everyone.
The sheriff, I believe, is on by phone.
I'm here.
Sheriff,
Good evening, everyone. I believe my first one is a personnel request.
Yes.
Authorized to fill a vacant and budgeted full-time communications officer position. I had a communications officer that resigned due to personal reasons. If we were to leave it vacant, it would cost a very large amount of overtime to fill every single shift because it is a full-time slot. His effective date of resignation will be October 23rd, and this is a salary of $45,841.
Move it, Ray Stats.
Sheriff Bartlett, can I ask a quick question? Sorry, it's the lady with health.
You can always ask a question, Supervisor.
What is the salary currently with the person who's been there? Is it going down because it's a starting position, or are they coming in at the current salary of the person who's been in the position?
The young man's been there a few years. He actually started out in the jail, so it's actually going down. And then he took the test, transferred over to communications. It's just kind of a sad story because he's working midnights, and right now there is no movement, and he just can't do it at midnights anymore. So it is going down.
Got it. I see it at the bottom there. It wasn't up on the screen. Thank you.
Yep. Okay, doke.
Yuri will move it.
So we have a motion by Stats.
I'll second.
Okay. All in favor?
Aye.
Opposed? Carried.
All right. The second general resolution that I have here is to re-enter into an agreement with New York State Office of Mental Health for treatment of mentally ill inmates. So basically we have an agreement with New York State. If I have an inmate that needs further treatment and it can't be done in the facility, they would transfer out to a state facility to help them. Again, this is a re-up that we do every year, and I'm asking permission that we continue to work with New York State Office of Mental Health for these inmates.
I move it.
I'll move it. Oh, we have a motion by Abdus. I'll second it.
Motion made and seconded. All in favor?
Aye.
Opposed?
I just have a question, Supervisor Sterling. How often does this happen?
Not too often, but it does happen once in a while. Right now, not too often at all because we really don't have that many inmates.
Right.
But yeah, I mean, if they have to go, they usually go up to Central New York Psychiatric, and that's where they would be shipped. We have had inmates in the past go, and if they aren't able to stand trial, or again, they need additional treatment is the biggest thing. That's where they would be shipped to help them.
Thanks.
And the last, to make everybody happy, the whopping out-of-county inmate report. Not a whole heck of a lot, really, because of the lack of inmates all over the place. We're getting most of it right now from U.S. Marshals. So for this month, it was $5,400. And for a grand total right now of $53,670. And that's all I have.
Sheriff Bartlett, this is Supervisor Shemidas. I have a question.
Yes, sir.
If I caught it right, at the meeting last night, did you say that you were not executing that eradication of marijuana grant that was passed earlier this year?
I pulled that, correct.
Okay, thanks for the update. I appreciate it.
No problem, sir.
Okay, thank you, Sheriff.
Thank you, everyone. Have a good evening.
Thanks, Sheriff.
Public Defender.
Hello, everyone.
Hello.
Hi, Shane.
Hello. So I have 3 resolution requests and a monthly report. The first resolution request is requesting board to authorize the chairman to consent to a 1-year extension of indigent legal service grant that is due to end December 31st, 2020. Needs to be extended due to funds still available. The said grant is distribution number 8, and that would be to be able to utilize that for the year 2021. And that pays the salary of one of my support staff and pays partial salary of one of my attorneys.
Move it, Ray Stat.
I'll second then.
Motion made and seconded. All in favor?
Aye.
Opposed?
Okay, so the next resolution request is, again, a request to have the board authorize the chairman to consent to a 1-year extension of an indigent legal service grant that is due to end December 31st, 2020. Needs to be extended due to funds still available. And this is the second counsel at first appearance contract known as the CAFA contract. This pays for the 4 act attorneys that provide arraignment services on off hours.
I'll move it.
I'll second it.
Motion made and seconded. All in favor?
Aye.
Opposed?
Okay. And the final resolution request is, again, a request to authorize the chairman to consent to a 1-year extension of an indigent legal service grant that is due to end December 31st, 2020, needs to be extended due to funds still available. The said grant is the Upstate Quality Improvement and Caseload Reduction grant. This is a grant that pays for some supplies, but mostly funds that will fund that new family court attorney position that the board approved a couple months ago. I do, in fact, have a new attorney that's going to start that position in a couple of weeks that we found.
I'll move the resolution.
Second.
Motion made and seconded. All in favor?
Aye.
Opposed? Okay.
And thank you very much. And now for the monthly report of September 2020. In the month of September, the Public Defender's Office had 219 new applications. That's the highest amount for the month of September for the last 3 years. That's probably partially due to the fact the courts are now open and just some backlog there. Additionally, as far as our total numbers, we have 1,625 total cases, criminal and family. In regards to arraignments, the CAFA attorneys conducted 25 arraignments for the month of September. And my staff and I, for the month of September, conducted 147 arraignments in the local and county courts. If there's any questions at all, happy to answer.
Anyone? Okay.
All right. Thank you, Chairman. Thank you, members, supervisors.
Thanks, Shane.
Zoni.
Have a nice evening. Be well.
Probation is next.
Good evening, everyone. Just one request to renew our software maintenance agreement with Automon. We've had this service and software for 10 years, and all of our caseload information is stored there electronically. It's a yearly contract. Was able to have it deferred for a few months, but the bill is now due.
I'll move it.
Motion made and seconded. All in favor?
Aye.
Opposed? Okay. Hey, Vince, does that still include like restitution or?
Yes.
Okay.
Yes, it does.
All right. Thank you.
Thank you, everyone.
Welcome back, Vince.
Thank you. It's good to be back.
Sorry, 911. There was a lot to that contract.
Yeah, my eyeballs are still rolling.
Sorry, make you all dizzy.
911.
Good evening, everyone. I have a resolution. John Parika's not on, is he, Kelly?
I don't believe so.
Okay. All right. Last month, we presented the comprehensive emergency management plan to the committee for review. This month, I have a resolution request to approve that comprehensive emergency response plan. And just to give you a little bit of a highlight from that, that plan was reviewed several times. We conducted a tabletop exercise and tested the plan. We then reviewed it again, made some adjustments to it, and then the committee actually voted on it to pass and move it forward. For those of you that don't know, the comprehensive plan is required under the Emergency Planning and Community Right to Know Act to create a comprehensive emergency plan. And so they're required to have it. And this is actually a plan that we've been working on for several years. And it is actually, we haven't had one prior to this. So this is going to be the first living plan for LEPC.
I just want to say I think you guys did a great job with this. Putting it all together, a lot of teamwork, a lot of effort went into this document. So I know there'll probably be a question or two, but I will move this.
I had a question about the resolution, but as a new town supervisor, I did see something from the Association of Towns about a requirement for towns to have this emergency response plan. So is it similar to the hazard mitigation plan where we can, as a town, simply adopt the county's version, or does the county having it cover us as the town? Do you have any information or knowledge there?
It is the county local emergency planning committee. I'd actually have to verify the question that you're asking, if you can adopt it or you're just under the auspices of the county planning committee.
Yeah, if you could just let me know, do we as a town need to do anything to be in compliance with the regulations, or are we good to go since the county has adopted it?
That I will get back to you on.
Thank you very much.
Can you get back to all of us on that same question?
Yes.
Thank you.
Thank you.
Hey, Rob, as part of this, you track businesses, specifically as stated, those that have extremely hazardous material.
Yeah, so the plan requirements, I'll go down through that real quick. There's a list of facilities that store EHS, routes likely to be used for the transport, and facilities that contribute are subject to additional risk due to proximity to facilities that store it. Methods and procedures to be followed by facility owners and local emergency medical personnel to respond to any release of any substance. Designation of community emergency coordinator and facility emergency coordinators. Procedures providing reliable, effective, and timely notification and persons designated in the emergency plan and to the public that a release has occurred. Methods for determining the occurrence of a release in the area or population likely to be affected by such release. A description or of emergency equipment and facilities in the community with EHS and identification of persons responsible for such equipment and facilities. Evacuation plans, training programs, and methods and schedules for exercising the emergency plan. So those are the requirements under CERP, and that's what's in there.
Okay. We have a motion, I think.
Yes, we have a motion.
I'll second.
Motion made and seconded. All in favor?
Aye.
Opposed? All right.
I'm going to bring up something that I was asked by Chairman Morrell to kind of do some research on with the declining 911 landline surcharge. We were looking at other ways to help with 911 funding, and I looked into the 911 cellular or wireless surcharge, and I just wanted to mention that I would be bringing a resolution next month back to present to the committee about adopting a cellular surcharge law, local law. Currently, just some background info. We're one of 3 counties that don't actually do it currently. Our landline surcharge back when we first started in the early 90s was in excess of $250,000 a year. We currently take in on the landline surcharge less than $100,000. And that surcharge is supposed to be used for funding of 911, if it be equipment, phone equipment, and or personnel.
All right, so you'll put something together for next month, right, Rob?
Correct, and I'll present it next month.
Is it a percentage, Rob, or is it a flat fee, or do we know?
It's a flat fee of 30 cents per contracted phone and or prepaid wireless cell phone.
Okay. We have your call volume information up on the screen of you.
Yeah, and the only other thing is the data for September of 2020. Our call volume for September of 2020 was 4,090 calls. That's incoming only, versus September of 2019 was 4,059. So it's just a tick above. In September 2020, we dispatched 1,169 EMS agencies, 377 fire agencies, 2,043 police polls, and 484 public service calls. And that's all I have.
Questions? Okay, thank you, Rob.
Thank you.
Thanks, Rob.
EMS.
How we doing, gang? Good?
Yeah.
All right. Am I last but not least?
No?
No? Oh. Doesn't matter. Just a few points of information I just wanted to bring to you and let you know. Kelly, if you scroll to the next screen, we've done an analysis for the first 9 months. And I guess it's not all on there, but if you...
Can you see it now?
Yeah, can you enlarge it just a little bit?
Well, that's the problem. Is that
If not,
enlarging
that's,
it for you?
there you go. That's
okay.
If you look over on the right-hand side, okay, each of the agencies on the left-hand side is broken down by call type. EMS is an emergency call, fire calls, miscellaneous, mutual aid, so on and so forth, okay? And then on the right-hand column, you'll see a county-wide comparison from 2019 to 2020. And this is for the first 9 months of 2020. You'll see that the overall call volume is down between 9 and 10%. Not unusual because during the pandemic itself in those months, March through May, call volume was down drastically. Not the end of the world. On the next set of statistics, for those of you that are new, it says CCEMS standby and CCEMS 911 calls. All right, again, on the right-hand column, you'll see a comparison 19 to 20. So the CCEMS standby for the 2,095 calls that we did in 20 means 2,095 times one of the local agencies was depleted of resources, had no ambulances in your area. So we moved an ambulance into your area 2,000 times in the first 9 months. And out of those 2,000 times, on the next line down, 400 times, there was a call in that particular area, an emergency call. So about 20% of the time, and this statistic is held true since the inception of this program, about 20% of the time, there is an emergency call in an area that's depleted of resources. And the end result is it saves approximately 7 to 9 minutes response time to that patient. And that's what this program is all about. So that's just information. Any questions on that one? Okay. Okay, Kelly, you can go back. Telemedicine update. A couple months ago, I informed you that we were going to look at some form of telemedicine at the 911 center. I think you'd have to be living under a rock not to realize or see ads on television where MVP offers telemedicine and CDPHP and all these insurers. Well, that's great, but what we were actually looking at is some sort of telemedicine that would fit into our countywide program. The purpose is that many times in the county, we are depleted of ambulances. We may be down to 1 or 2 ambulances throughout the whole county due to the call volume. And this places a lot of stress on the 911 dispatchers to find an ambulance to send to a particular call. Many times, more often than not, when we're down to 1 or 2 ambulances in the county, the 911 dispatcher will receive a very low acuity call. And by that, I mean, Susie Q will call up and say she's had a cold for 3 days and now she wants to be transported to the emergency room for evaluation. Well, what that does is that strips another ambulance out of the service, and that could be maintained for a true emergency call. So what we're looking at is try to incorporate some telemedicine into the 911 system that at that point in time, they could maybe divert that call to telemedicine and avoid the transport at that particular time. We have looked at about 3 providers to date. One you've heard of is, what is it? I can't remember the name. It's in Rensselaer County, 911 Emergency Anywhere, or a name like that. But the fault of that one is it is geared strictly towards the Medicaid population in our county only. And that would not help in this particular situation that we're talking about. We interviewed another provider, and they were very, very costly. They're in some large municipalities throughout the country, and it just wouldn't fit into our system. So what we've been trying to do is customize a system that would work for us in Columbia County using the existing providers in the ER, the existing physician group, and that is called Envision Physician Services. They not only provide physician services to CMH ER, but they also do the primary care centers in Copiague and Volusia. So they made a short presentation to the EMS Advisory Board on Monday. All the agencies are on board with this and trying to move forward. The hospital has also agreed to work with us on this. And so what I'm telling you is stay tuned. I think we're coming up with something novel that's probably not been done before, but I think it will work in our system and help both our patients in our 911 center, as well as keeping EMS crews available for strictly emergency calls. So stay tuned. Last one is the training update. All of our equipment, we teach EMT classes. All the equipment has now been moved to the new training center. It is just unbelievable. We're so thrilled because our equipment has been scattered everywhere. We've been teaching classes at firehouses and the college. We were kind of kicked out of the college due to the construction, but we now have a home and there's a current EMT class taking place now. So that's it for me.
Yeah, I'll be out there tonight to see it for Fire Advisory Board.
Yep, I'll be on Zoom.
Any questions? All right, thanks, PJ.
Yep.
Fire Coordinator.
Hi there, folks. I can be last but not least.
Hey, and before George talks, I just want to give kudos to George. Thank him for making the accommodations for us for the EMS equipment. They went overboard, put up additional racks for us and everything. So thanks, George.
Hey, it's a team effort. You're welcome. My pleasure. I'm just looking to transfer some funds from our miscellaneous equipment account to the repair account. We had to make some repairs to our hazmat truck. We had a wiring meltdown in one of the lighting circuits on it that took a little bit more than we anticipated to get it repaired. So I'm just looking to transfer some money just to cover those repair invoices.
Morel will move it.
I second it.
Motion made and seconded. All in favor?
Aye.
Opposed? Okay, George.
All right, thank you. And I will see you later, Mr. Chairman.
Yeah.
Okay, Mike, that's it for agendas anyway.
Anything else from anybody? Motion to adjourn?
Motion.
Second it.
All in favor?
Aye.
Opposed? All right, thank you very much.
Take care.
Hey, Kelly.
Good night, everyone.
Hey, Kelly.
Yes.
On that last vote, I'm an aye. I had to step away from the computer for a minute. I don't know if you marked me
Okay.
because my face
No,
wasn't.
no, you're good.
Okay.
You're good.
Thank you.